So good afternoon, everybody.
Good afternoon, ma'am.
So today we'll start with AETCOM module 2.7. So this is also a case study on autonomy and decision making. Okay, so can we start?
Yes, ma'am.
So the learning objectives for this session. At the end of the session, second MBBS students should be able to, firstly, define consent. Secondly, describe informed consent and refusal in clinical practice. And thirdly, identify the medico-legal, socio-cultural, and ethical issues in the given case study. Is it clear? Are the learning objectives clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So you're already familiar with consent, isn't it? The class has been taken. Consent, according to Section 13 of the Indian Contract Act, is defined as when two or more persons agree upon the same thing in the same sense. Okay? When two or more persons agree upon the same thing in the same sense, they are said to consent. So it is a free and voluntary agreement, compliance, or permission for an act. This is the meaning of consent. An informed consent is a process, not an event. It is not just a signature on a consent form. Rather, it is a dialogue between the doctor and the patient, where the doctor tells the patient about his or her condition and gives him the options. And after understanding and digesting the information, it is the patient who decides whether to go ahead with the treatment. So, in order to make an informed decision, the patient must have enough information. Sometimes as doctors, you may wonder, how much should we tell the patient? Is it necessary to tell the patient everything? Each and every detail of the test or the procedure or the operation or the treatment? How much are we supposed to disclose to patients? Well, sometimes, a patient may come who is illiterate. That patient may not be able to understand what you're telling him. So it depends on the person's level of education, how much he or she is able to understand. But there are certain rules and certain things or pieces of information which you must disclose, which you have to disclose. And if you feel that the patient is not able to understand, you should explain to a relative or to the attendant or accompanying person, the next of kin, and maybe the father or mother, wife or husband, or in the case of adults, adults' children, grown-up children. Okay, in case a procedure is contemplated for an elderly person, you can explain to the adult children if you feel that the patient is not able to grasp the information. So how much are we to disclose to patients? There is no golden rule for this. It varies from country to country. But in general, or as a rule, the doctor should provide the patient with information which will enable the patient to make a balanced judgment. In other words, the doctor should give reasonable information to enable the patient to make an intelligent decision. Is it clear? So, the patient should have enough information in order to make a decision regarding his or her treatment. So the information that we give should be necessary and relevant information in a language and terminology that the patient understands. This is very important because we have, patients hailing from different backgrounds. Sometimes they may not be able to understand the language that you are speaking to him or her. So it is important that the patient understands your language and not just the spoken language, not just the vernacular, but also the terminology that you use. If you're going to use very, medical or very technical terms like appendicitis, cholecystectomy, the patient will not understand a thing. So you have to use simple terms. You have to use the patient's own language. You see, in this surgery, I have to remove your gallbladder. Okay, your gallbladder is diseased and I have to take it out. So I will be making a small incision, under general anesthesia. You will be under anesthesia and I will be conducting this procedure on you. Okay, so the language should be simple and easy for the patient to understand. So what are the components of informed consent? Components of informed consent. How much information should be provided in the written consent form? Okay, as I said before, informed consent is not just a signature on a consent form. Rather, it is a dialogue between the doctor and the patient. It may take more than one session for this. Okay, So you have to make the patient understand, and then only the patient decides what to do. So first of all, you have to tell the patient the diagnosis. Suppose there was a case, after taking the history and doing a clinical examination, you suspect that the patient may be having some cardiovascular disease, okay, maybe ischemic heart disease or unstable angina. You have to inform the patient about the diagnosis. Okay, so you can give the medical term like unstable angina or ischemic heart disease, but you also have to explain to the patient what exactly it is. Okay, see, patient is not always from a medical background, isn't it? If you say ischemic heart disease, the person will not understand. So you have to say you have a disease because of the narrowing of the arteries leading to your heart. So it should be in that way, in a manner that the patient understands easily. So provide the diagnosis, and then the treatment, you offer the treatment. Or perhaps, before going ahead with the treatment, you have to do some more tests. You have to run some more tests. Okay, in this case, you may want to do an ECG, or you may want to do some blood tests, or you may want to do, an angiogram, a diagnostic angiogram, to arrive at a diagnosis. So you have to explain the purpose of the test or the purpose of the procedure. What are the benefits of the procedure? And you also have to explain the risks and possible complications. Okay, what are the risks of this procedure? What are the possible adverse events that can occur? And what are the possible complications? That also has to be told to the patient. Then, are there any alternative tests or any alternative treatment with the relative benefits and risks? This also has to be told to the patient. And the consequences of not accepting the treatment. Briefly discuss the consequences of not accepting the treatment. So these are the components of informed consent. Let's take the example of coronary angioplasty. Patient has been diagnosed with unstable angina. Okay, you have told him the diagnosis, and now you have to explain the procedure. So you just briefly explain what is this coronary angioplasty. Okay, in simple language and in terminology that the patient understands. I will have to pass a catheter. Okay, you can see here catheter. I will have to pass a catheter through one of the arteries in your lower limb or in your thigh. I will be making a small incision in that area, okay, in your thigh. Okay, and I'll be passing a catheter or a tube to the heart. Okay, and then I'll be using an imaging modality to study the arteries which supply the heart. Okay, so in simple language, you can explain to the patient what is the purpose of doing coronary angioplasty. What do you want to find out? Okay, through this procedure, and what are the benefits? Okay, by doing this procedure, we will be able to find out if there is a blockage in any of the coronary arteries, and we will be able to localize the lesion. Okay, where exactly the lesion is. Okay, so purpose and benefits. Then risks and possible complications. Every procedure, this is an invasive procedure, isn't it? Minimally invasive, but you're passing a catheter through the artery, and the patient may feel discomfort. The patient may not like it, so you have to explain exactly what you're going to do. And, there may be a risk of pain. You may experience pain during the procedure. You may experience discomfort, or there may be slight bleeding. Okay, so all these have to be told. And then what is the alternative test? Okay, see, the alternative test can be, an imaging technique. Okay, like a CT angiogram. Okay, but what are the benefits and what are the risks? That has to be explained. Okay, and to what extent can you diagnose with a CT angiogram, even though it is non-invasive? But what is the extent or what is the accuracy of, doing the alternative procedure? Okay, and if you do not accept, if you decide not to go ahead, with the procedure, what are the possible risks? What are the possible consequences of not going through the procedure? Okay, so is that clear so far?
Yes, ma'am.
Yes, ma'am.
Then the patient, even after understanding everything, the patient may still refuse treatment. Okay, so I think I already discussed this in one of the earlier classes. Patient refuses treatment. You have to ask the patient again, give the patient a chance, because you know that it is in the patient's best interest. Remember, the overriding duty of the doctor is to act in the best interest of the patient. Okay, this is a fiduciary duty. Okay, there is a term called fiduciary duty or fiduciary relationship, a relationship based on trust. Doctor-patient relationship is a relationship based on trust and faith. The patient trusts you. The patient trusts the doctor. That's why he is coming to you. So, the doctor has an overriding duty to act in the best interest of the patient. Now, if the patient refuses the treatment, you know it is not in his best interest. So, you have to ask again. Give the patient a chance. Give the patient time to think it over. And then, but if the patient still refuses, then the patient has to sign a form. Okay, this is an informed refusal form. Okay, the patient has to sign a form, and every stage of the informed refusal has to be documented. On which day and date, why the patient is refusing. Okay, and then you can still tell the patient, see, you have time to think it over. So, if it is not an emergency, if it is an elective procedure, you can give the patient time to think it over. Patient might change his mind. Okay, so this is informed refusal. Please remember the word document. Every step has to be documented. Otherwise, you will be in trouble. Somebody may charge you that you have not treated the patient. Okay, so you have to document that, see, the patient refused treatment. And, patient cannot be forced to do something that he doesn't want to, but it has to be documented. So let us go to the case study, today's case study. Read the given case study and reflect on the following points. So first, let us go to the case study. Are you able to see the screen?
Yes, ma'am.
Okay. So Sanjeev, are you there? Sanjeev?
Yes, ma'am.
Can you read the first paragraph?
Yes, ma'am. A 54-year-old man named Mr. Surendra Patel is admitted for acute chest pain in a medical center. His father had died of a myocardial infarction at the age of 60. 2 years ago, his brother had been admitted to a hospital with a myocardial infarction and had died after complications following an angioplasty. Mr. Patel is a diabetic and is on multiple oral hypoglycemic agents with moderate control. He is a businessman with his own small industry. After initial stabilization, the patient is comfortable and pain free after analgesics, nitrates, and statins. Preliminary blood tests and ECG confirm an acute coronary event.
Okay, thank you, Sanjeev. So I think the story is clear up to this point. Okay, there was a businessman named Mr. Surendra Patel. Okay, so he has been having episodes of acute chest pain. So he goes to a medical center and, the preliminary tests are done and the doctors diagnose an acute coronary event. Okay, so and he was treated with analgesics, nitrates and statins. Okay. Mayuri Roy, are you there? Mayuri Roy.
Yes, ma'am.
Could you read the next paragraph?
The next morning, senior cardiologist makes round and reviews the patient. You have unstable angina, Mr. Patel, and require an angiogram. You may also require either a stent or pulmonary bypass after the procedure. The nurse will provide you with the necessary paperwork. Please sign it, and I will plan the procedure for 4:35 a.m. tomorrow morning.
Okay, thank you. Is it clear so far? You're able to follow the story? Is it clear to all of
Yes,
you?
ma'am.
Okay. Sansuki Langste, are you there?
Yes, ma'am.
Please read the next paragraph.
Dr. Sahib asked Mr. Patel, I am not comfortable of an angiogram. My father died on the table when an angioplasty was being done. Aren't there other tests you can do? I am not happy with this option.
Okay, thank you, Sansuki. So you can see over here, there's a family history of, coronary artery disease. Father died of a myocardial infarction. Brother died on the table when angioplasty was being done. So Mr. Patel has, good reasons to be anxious and to be apprehensive. Okay. and knowing that angioplasty is minimally invasive. It is an invasive procedure. So he is not very comfortable with it. Okay. So he asked, aren't there any other tests you can do? I am not happy with this option. Okay. Aaron, are you there? Aaron.
Yes, ma'am.
Yes. Could you read the next paragraph?
Your brother would have had it with someone else, Mr. Patel. I have the best hands in town. Nothing will happen when I do it, retorted the cardiologist.
Okay. Thank you, Aaron. So this is a dialogue. Okay. Conversation between Mr. Patel and the doctor. Okay. Okay. Rimchi Marak, are you there? Could you
Yes,
read the
ma'am.
next paragraph?
Yes, ma'am. Aren't there any other options to see what I have? Is this the only test? I have read somewhere that you can do a CT angiogram, persisted Mr. Patel.
Okay. Okay. Thank you. So nowadays, see, patients, they Google information and they are quite knowledgeable. Okay. So they have some idea about illness, disease, medical conditions. So, we must not think that, doctor knows best and patients don't know anything. It's not like that anymore. Okay. Nowadays, patients also know about medical conditions. Okay. Ativi ke Zimomi, please read the last paragraph.
Are you the doctor, or am I the doctor? Retorted the cardiologist angrily. If you are ready to do as I say, sign the papers and I'll see you in the cath lab tomorrow. Otherwise, you are free to get discharged. He stomped out.
Okay, thank you. Thank you, Ativi. So I would like you to, go through the story and just reflect on it. Okay. Go through the story and just reflect on it in a similar way that you reflected on the previous case study. You read it carefully. Okay, and especially the dialogue between the doctor and the patient. Okay, and tell me your observations. Okay, so points for reflection is similar to the previous case study. Read the given case study and reflect on the following points, roll number wise. Okay, so that we have a better discussion. So the first point is, what have I learned from this story? Okay, what have I learned from this story? See, you are all going to become doctors one day. Maybe a handful of you are going to become cardiologists, okay, or nephrologists, neurologists, or some of you may become surgeons, gynecologists. Okay, so think of yourself, from the doctor's perspective and also from the patient's perspective. If I were the patient, how would I be feeling? Okay, what would be my feelings, my, emotions at that time, attending the doctor's clinic, knowing that there's something wrong with me, knowing my father, passed away because of coronary artery disease, brother also died. Okay, so, that apprehension, that fear. Reflect on the story both from the doctor's perspective and also from the patient's side, patient's perspective. Okay, so what have I learned from the story? I will allot to group 1. That is roll number 1 to 12. I think you know your roll numbers, right? You're aware
Yes,
of the
ma'am.
Yes, ma'am.
Okay. So, see, you don't have to meet physically. Nowadays, it's not really advisable to meet physically. But even over phone or, virtually, you can discuss with each other. Okay, what have you learned from this story? Okay, both from the doctor's perspective as well as from the patient's perspective. Is it clear? Roll numbers 1 to 12?
Yes, ma'am.
Okay, the second point for reflection. How can I apply this knowledge in my future practice as a doctor? So this I will allot to roll numbers 13 to 25, group 2. Group 2, roll numbers 13 to 25. Is it clear? You're there, right? Roll numbers 13 to 25?
Yes, ma'am.
Okay. Then the next point, what are the medico-legal, socio-cultural and ethical issues in this case? Okay, so this I will give to group 3. That is roll numbers 26 to 37. Okay, 26 to 37, roll numbers, are you there? Anybody?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, so this point is given to you, okay, for reflection. And we can come back next week and discuss. And number 4, what skills do I need to handle such a case? So the last set of roll numbers, roll number 38 to 50. Are you there? Anybody from this group? Group 4, roll number 38 to 50? Okay. Okay, so these are the points for reflection. Next week we will come back and we will discuss, okay? And 2 or 3 of you from one group can speak up. Okay, anybody? Or anybody who's ready with the answers, okay, can speak up after reflecting. You have 1 week to reflect and to think it over. Okay, is it clear?
Yes, ma'am.
Yes, ma'am.
Okay, ma'am. Yes, ma'am.
So there is one activity, I don't know whether this is feasible or not. You just think it over. If it's feasible, each group can perform a role play based on the case study, record it. Okay, you take a video and send the video before the next class. You can send the video, to the WhatsApp group or to my personal number. Okay, so I'm just giving you an idea. The scene can be a doctor's clinic. The characters, the doctor or the cardiologist, then the patient, nurse or assistant, attendant. Or if you feel that there are too many people here, too many characters, you can restrict to doctor and patient. Because now we have to maintain that social distancing and,
Yes, ma'am.
yeah. See, please wear masks and maintain social distancing while enacting the role play. Okay, so you have 1 week to prepare. And, you can focus on the dialogue between the doctor and the patient. Okay. And it can be, it doesn't have to be just a male doctor and male patient. It can also be female doctor and female patient or vice versa. Okay. So I think I can entrust you to do this. And you all, are much better at technology than we are. I was seeing that sometimes, even from different locations, they somehow merge the videos and then combine it to look like a single video. I'm sure you're much more well versed at that than I am. Okay. So you think about it. If you feel it's doable, you can do it and you can send me the videos. Or you can send it to the class group. I think Dr. Kishant or somebody, from our department is there in the group. So you can send it to him or you can send it to anybody. Or you can send it to my personal number. Okay. So, okay. That is all for today. And it would be nice if we can do this activity. But then, maintaining the necessary, COVID protocols. Okay. Don't break any rules while doing this role play. Okay. So is it clear?
Yes, ma'am.
Okay. Do you have any doubts or you want some clarifications to be made? Anybody?
No, ma'am.
Okay.
No, ma'am.
Okay. Thank you very much. We will see you next week then.
Thank you, ma'am.
Okay.
Thank you, ma'am.
Thank you. Thank you. Thank you.
Thank you, ma'am.
Thank you.